Hello, everyone, and thank you for attending this talk. So, as we all know, in healthcare, every minute counts, and yet most of the time, hospitals they react instead of anticipate. The hospitals can generate enormous amount of data, and yet most of the decisions are made in the dark. So today, I'm going to show you how we can use AI to turn all this data into foresight to enable true communication to have better decision making and how AI can give hospitals the power to lead and not to follow. So I will start this talk with telling you a little bit about myself, my journey, how I ended up at Optacare at the startup. Then I will explain two out of the four products that we have in our catalog, Predict and Stock, one for anticipating patient flow, and the second one is for smart supply chain optimization. And I will show you what the healthcare staff is facing nowadays, what are the challenges, and how those tools based on AI algorithms, how they can in fact help the hospitals uh, turn in this data into insight, how they can use the predictions in order to make their life easier to anticipate and not to react after a crisis. And then I will conclude with how I see where we are moving forwards towards what we call a predictive hospital, and some examples on what's going to happen, in my opinion, in the next couple of years. So I'm a computer and communication engineer with a PhD in artificial intelligence. I focused during my PhD on machine learning algorithms, where I developed and improved some classification algorithms to detect intrusions in industrial systems. I have 11 years of experience in higher education and research in France and abroad. So 5 years at University of Technology of Troyes and 6 years at the American University of Kuwait, where I collaborated and I participated in many AI research projects. I supervised many graduation projects, and all those were linking AI and IoT. And then I did a major shift in my career, and I moved from research to private sector to healthcare innovation. And since 2024, I am the head of the R&D department at Optacare, which is a small startup that's growing very fast. And we design AI solutions that are fully integrated into hospitals' workflow. And I'm currently the product owner of two of the four solutions that we have at Optacare, Predict for the emergency departments and Stock for the supply chain optimization. The story of Optacare, so it was founded by our CEO in 2013 with the main focus on industry and with a partnership with the University of Technology of Troyes. And for the record, most of our employees are got either their engineering degree and or their PhD degree from the University of Technology of Troyes. And initially, we were focused on a customized solution for supply chain optimization only for industry, and we have some big names in our clientele like Michelin or Elo, the European leader. And we had one solution for the emergency department that was deployed since 2015 at Troyes Hospital. It was like the basic version, the version V0, but the company was focused on customized solutions for the industry until 2 years ago. So Troyes Hospital remained our only client for almost 8 years until 2 years ago. What happened 2 years ago? COVID happened. And we all know what we went through during this period, the unprecedented pressure on the healthcare systems, the uncertainty. So hospitals didn't have any vision on what's coming for them. They needed real-time anticipation solutions, but those solutions did not exist. So they didn't know how to better allocate resources, how to anticipate the demand of the supply management. And the solutions that were used back then and still used, in fact, by many of the hospitals, in fact, which are manual or static processes that base their decisions or their predictions on previous years or on a moving average. So those solutions were barely sustainable under normal conditions. So let alone under a crisis condition like the one that hit the healthcare system like COVID. So which resulted in what? human exhaustion, stress, burnout, and reveal the urgent need for smarter and adaptive solutions. So, during COVID, we were contacted by a couple of of the hospitals. Not all of them were our clients since we only had one back then. And we were asked if we can develop and improve the current solution that we have and develop other new solutions to meet the needs of the healthcare system, to help them anticipate and not just react to crisis. So in fact, today we ended up with 4 solutions in our catalog. So I don't have time to explain the 4 solution. I will be concentrating my effort on the first 2, since I'm the product owner of those solutions. And so now we have 4 solutions: Predict for patient flow and waiting time forecasting at the emergency departments, Stop for dynamic supply chain optimization, HR Planner for intelligent staff scheduling under constraint, and HDG Planner for patient journey optimization. And all those solutions were somehow, they started somehow with either a master's degree with our partner, the University of Technology of Troyes, or a PhD thesis with with the UTT, which shows, in fact, the strong bond and the strong correlation between what we do in research and what we can apply and implement in real life. So, and as a result of the hard work that we did in the last couple of years, we will be entering in 2026 a test phase with more than 70 hospitals at once, so which is huge for a small startup like ours. But this proves, in fact, the added value of those solutions to the healthcare system, and you will understand better when I explain those solutions. So I'll start with the first one, which is Predict, to anticipate patient flow and the waiting time at the emergency department. So I will start by showing you the evolution of the number of patients arriving to the emergency departments in France between 1996 and 2023. So we started with around 10 million patient visits or patient arrival in 1996, and this number kept growing up until it reached around 22 million in 2019, just before COVID happened. And then we have the artificial drop in the number of arrival. Why artificial? Because of the lockdown, the hospital policies, and then it went back up until it reached in 2023 a total number of 21 million visits in the ER, where 50% of the patients that arrived to the ER spent more than 3 hours waiting in the emergency departments to be taken care of by a doctor. And this number, 3 hours, was 10 years before that. It was 2 hours, 10 minutes. So we had in almost 10 years an increase of 40% of the average waiting time of more than 50% of the patients, which shows how congested and how the high workload that the healthcare staff have on their shoulders. So many challenges are facing the healthcare team. So we have a rising number of patients, but a shrinking number of staff. This is very significant. We have the unpredictable demand in the ER. So with zero vision, with zero visibility of what's going to happen in the next days, weeks, they cannot anticipate the crisis. So all the decisions are made under pressure to react to a crisis. So with limited data, and this will, in fact, increase the pressure on the healthcare teams, the stress, the burnout risks, and also we have an impact on the patient experience with longer waiting times, with reduced quality of care, and both the healthcare staff and the patients will be frustrated because neither of them are being, in fact, so either the patients, they are waiting a lot with reduced quality of care, and the caregivers are stressed out a lot with very high workload, and this will lead them to be frustrated. So the current approaches that are used in the healthcare system, which are, I can call basic approaches based even on moving averages. So, or they check what happened in the past years, and they reconducted as predictions for the current years. But those traditional approaches, they cannot capture the complexity in the data because we have many challenges in the data. We have most of the time incomplete and or inconsistent data. So we received many data from our clients where the patient spent 27 days in the ER waiting to be taken care of, while we all know that this is not accurate. So we have many examples like that. So we have either incomplete or inconsistent data. We have the factor of the seasonality and the local patterns that will impact a lot on the predictions, flu waves, holidays, weather, etc. External events like epidemics, local festivals, health policy changes, which is also will impact the number of hospitalization, for example, after an arrival to the ER. Sudden shifts during crisis like COVID or other crises, and most importantly, the data before COVID and the data after COVID, they don't share the same pattern. So the policies have evolved, whether the patient behavior or the healthcare policies. So all those reasons, for all those reasons, the traditional approaches, they fail to capture this complexity, and they lead to poor anticipation results. And this is, in fact, where Optacare and the solution that we have at Optacare, which is Predict, can be very helpful for the hospitals to anticipate patient flow and to allocate resources based on very accurate predictions. So we have advanced AI algorithms that are trained on historical and contextual data. So all the features that might have an impact on the predictions will be taken into account. We have dynamic forecasting that are updated every day, and we can do it for long term, up to 1 year. And all this through interactive dashboards to simplify the reading of the data for the healthcare staff and to make a real-time visibility at different time zones. So what are the key features of Predict? So first we do forecasting at the emergency department, so the number of visits for the short term and long term. So we have developed advanced models that can predict for the next 1 year with an accuracy of over 90%, one shot, so without any update or so one shot for 1 year, we can do it with more than 90% accuracy. Then we do the forecast of the total number of hospitalization as a result of those arrivals to the ER, also for 1 year. And we go even further. We do the forecast of the hospitalization, not only the total number, but for per department, per sub-department, so per specialty, per department, or per care unit. So we can go as detailed as the data allows. We do forecast on the dynamic bed need estimation and the forecast of the patient waiting time at the ER before being taken care of by the doctor, and the forecast of the congestion in the ER department. And all those features will help a lot, as you will see in the next slides. It will help a lot the healthcare staff to anticipate any crisis, to anticipate all the peaks, and to anticipate the congestion in their ER. So it will relieve, so they will be relieved, and they can move from reacting to anticipating and turning this uncertainty that they have nowadays into control. So this is the homepage of Predict. So it's half of the homepage, so the other half will appear in the next slide. So here, in fact, we will display all the needed information that summarizes the situation of the day. So at the upper left, we will display the total number of patients, so the prediction of the total number of patients that are going to arrive into their ER on this day, which is the 6th of November. We are going to display also the total number of hospitalization that among those arrivals to the ER for this day, the estimation of the saturation, which is based on also some data that we are going to recover from the hospitals, like how many pre-programmed rendezvous or how many beds are closed. And by closed, it's either for HR, human resource lack in human resources or in material. And we will display also the hour for which they will have, or patients will have, the longest waiting time in their ER. So it's 2 a.m. in this example. So all this information is for one day. Then we will display the day condition, like the weather condition, the tide condition, if there are specific periods or not, cultural events, sports event, etc., which might have an impact on the predictions, the saturation and the availability of the bed. On the right, we will show them, in fact, the distribution and the availability of their beds on a global level and for the main departments that they have. And when they hover over any of those departments, they were able to see how many, what's the total number of beds for this department, how many beds are available, how many beds are unavailable, whether occupied by the rendezvous or closed for specific reasons, and how many beds they are going to need for this day, which are the hospitalization among the ER arrivals. Then we are going to show them a pie chart where we will display all the hospitalization, and they can have a distinction between, for each department, how many hospitalization are coming from the pre-programmed rendezvous and how many hospitalization are coming from the forecast, so from the patient arrival into their ER. For all the departments that they have, we have a distribution by gender. And another important distribution, it's by age category. And the healthcare staff, they pay a lot of attention to this category. So the elderly people, the elderly category, because for many reasons, they are more fragile. And the proportion of hospitalization of the people belonging to this category is a lot higher than the proportion of hospitalization for the adults or for the children. So all this information, we are going to show it for one day for in a global view, but they can choose different other views, like per department, per sub-departments, and all this data will be updated. So this is for one day. And they can choose, of course, a horizon of 1 month, 2 months, up to 1 year. And now we are going to show them for every day in this horizon the total number of the patients, so the forecast of the total number of the patients that they are going to receive for every day, the confidence interval for every day, the total number of hospitalization also for the horizon, for the chosen horizon with the confidence interval, and the total number of pre-programmed rendezvous. So they are going to have the full vision, the full picture of for every day, how many patients they are going to have, how many hospitalization, what's the confidence interval for each one of those indicators for the horizon, for the chosen horizon. So if they choose 1 year, they will have the vision for 1 year. And the same pie chart, so the distribution of the hospitalization by department or sub-departments is based on what they choose from this scrolling window. Distribution by gender and distribution by category, by age category. So here in this example, we have almost 1/3 of the arrivals are going to be elderly people. So the healthcare staff can take this information and try to anticipate as they see better for them. And then we show them the evolution of the patient arrival by category of age, so by day, so not only the total number, but again, day by day, and also the distribution by gender on the horizon, and the distribution of the saturation also of their beds or their departments day by day. So all this information, in fact, if they use it in the correct way, they will be able, one, to anticipate the peaks, if there are going to be peaks, better allocate resources, and put the correct resource at the correct place, because here we don't see it in this screenshot, but we can go, we can have a view by department, by sub-departments, by care unit, so they can see in each care unit, in each sub-department, how many hospitalization they are going to have. And this is the second part of the main dashboard, where we, in fact, we display the waiting time of the patients arriving on every day. We have, in fact, we calculate and we forecast 3 different waiting times, but the most important one is the second one. So the first waiting time is when the patient first meets the nurse, or we call it the first contact, when the nurse will make the first diagnosis whether the patient needs, whether the patient condition is critical or not. Then we have the main waiting time for the patient, and this is where the patients wait the most. This is the average waiting time in the ER before being taken care of by the doctor. And we have the average length of stay for the patients who arrive on an hourly basis. So all those forecasts, we do it on an hourly basis. So when you hover, when the nurse or the doctors, they hover over any of those points, they are going to see that between 3 p.m. and 4 p.m., they are going to have, the patients are going to wait on average 10 minutes before the first diagnosis, on average 2 hours, 12 minutes before they are being taken care of by the doctor, and the average length of their stay will be on average 3 hours, 32 minutes. And we also do a forecast on another indicator, which is a congestion indicator that will show them in this example that between 3 p.m. and 4 p.m., there will be, on average, at the same time, 21 patients waiting in their ER to be taken care of. So this is a congestion indicator that's going to show them that this is the peak of the average number of patients waiting at the same time in their ER. So they know what to do with this information, how to allocate better resources, etc. So another feature for Predict is, as I said, we do the forecast of the hospitalization, not only the total number, but by department, by sub-departments, and by care units. So when, for any day, so they can choose this view by day. For any day, they can choose to, in fact, they can see the availability of their beds for the department in general, for the sub-department, and for the care unit. And when they hover over any of those lines, so here they can see that for this care unit, the soins intensifs, the total number of beds is 8. 7 are already unavailable, and the forecast is telling them that they will have one more bed in this care unit, so the availability will be 0. And of course, they will receive an alert that they are saturated. And those alerts, all of them are customizable, so they can decide to receive the alert at 80%, 90%, 100%. So it's up to them. And so this is the view by day, and we have a view by department. So they can choose a department and see for the upcoming months the distribution of the beds and the availability of the beds for the upcoming months. And then again, so they can see for any of those days how many beds are available, unavailable, and the forecast of the hospitalization for this day. So this will give them the vision per department for the upcoming months for the hospitalization. We also calculate another indicator for the hospital, which they call the BGML, the minimal needed number of beds to satisfy at most 25% of the hospitalization. So this is just to avoid overbooking of beds. And we also display a comparison, so they can choose any horizon, so the last 1 month, 2 months, 3 months, and they can compare the actual value, so the real number of patients who arrived to their ER, and they can compare it with the forecast that we did and we will show them for this horizon um, an accuracy measure. So here in this example, so we were able to do forecasts with 89% accuracy, and we show them also the error in terms of patients. So here we have on average 14 patients as an error for an average arrival number around 150 patients per day. And for each one of those points, we show them the forecast, the real number, the confidence interval, the temperature, the precipitation, etc. So, so we have many benefits for the hospitals, for the healthcare staff, and also for the patients by using our first solution, Predict. So, if we look at it from the operational efficiency point of view, so already we have an improved resource allocation and shift planning for the short term and medium term and even long term. And this will reduce overcrowding and bottlenecks during peak hours. And one of the hospitals that contacted us in order to improve the solutions. So one of the reasons that they are using Predict is they need to anticipate the Christmas vacation, the summer vacation, the winter vacation. So they do the forecast 2, 3, 4 months ahead. They check the forecast and they allocate the resources accordingly. And also because staff they need to go on vacation as well, so they need to uh, decide how many staff I can allow to have to go on vacation, how many staff I need for the upcoming vacation. From the point of view of the patient, so of course the patients will have a decreased waiting times and a smoother patient flow. So since the hospitals are now able to anticipate better the upcoming peaks, so they will be able to better allocate resources. So the waiting time will decrease. So this is normal and logical, and they will have a better continuity of care and faster access to treatment. So this is how the patients are going to feel. And also the staff well-being. So when you know how to anticipate and what's coming for you for the next days, for the next weeks, so you will be able to anticipate better. So you will have less stress and less burnout risk because you are not now reacting to a crisis, you are anticipating the crisis. So you are ready for it. You are not just reacting to something that you didn't know that's going to happen. So you knew that this is going to happen, so you have already uh, the tool to deal with this crisis in advance. So teams can plan ahead instead of reacting under pressure. And from a strategic decision support point of view, so of course the forecast will help the hospitals to to better plan, to better do the staff policies, and to be ready from the emergency department's point of view. But also, you will be able to enhance coordination between different departments. So when we display the number of hospitalization for the cardiology, for all of those small departments or sub departments, if they are already saturated, they know that they are going to have more patients. So either they, for example, early discharge some patients, or they transfer some patients from one sub department to another one that's less crowded, and they anticipate this need. So it also enhances the coordination between the different departments of the hospital. So, so in summary, Predict empowers the hospitals to forecast patient flow, to optimize resources, to improve both patient outcomes and staff well-being. So, Predict is somehow bringing back control to the hospital, allowing them to anticipate, to adapt, to lead. This is very important, and to move from reactive management to proactive anticipation with all the data that we are turning it into predictions, into foresight, and all of this should be turned into actions afterwards. So now I move to the second solution that we have in our catalog, which is Stop for smart supply chain optimization. No, as you saw, we have a huge pressure on the healthcare system, whether on the emergency departments, on the other departments, and they don't have the visibility of what's going to happen in the next days, weeks, months. And of course, since they do not have any tools to anticipate the demand, the patient arrival, etc., this will be reflected as well on the hospital supply chain, which are also under constant amount of pressure because they don't have this visibility and because of many other factors. So I'm going to explain in the next slide. So also the supply chain of the hospitals and the healthcare sectors are under a lot of pressure. So their main, uh, uh, in fact, job between brackets is to ensure the continuous availability of the medication, but while managing many other contradictory factors like tight budgets. We all know that they don't have unlimited budgets. Volatile demand, and this is very important and very crucial, especially for anticipating the demand, and the limited storage capacity. And here, in fact, of course, they don't have unlimited storage capacity, but even if they had, they shouldn't order an unlimited amount of units because of many negative consequences like the cost, like the waste, etc. So they need to ensure this continuous availability of medication while managing all those constraints, and this is not easy. And like the traditional approaches that the emergency departments use to anticipate, so the basic ones, we have also, and we were shocked to learn that many big hospitals, they are still using some basic traditional approaches to anticipate the demand. And those approaches are either like static replenishment parameters that are updated once every year or once every 2 years. And this is, of course, this does not reflect the most recent trend, the peaks, the seasonality, etc., or other approaches are based on the average daily consumption model. So they check for the past couple of years how many units I use from each product, and I do a moving average, and I anticipate that for each one of the upcoming days for the next 1 or 2 years, I'm going to need 10 units of this drug, which again does not reflect the seasonality, does not reflect the trends or any anomaly or any peak in the activity of any of whether epidemic activity or a flu wave, etc. And in addition to all those limitations of the current approaches, there is no link to real future demand or forecast because they are using or copying what happened in the last years, and they are using it the same for the upcoming years. So this leads to what? Frequent stock outs of critical or not critical items, so frequent stock outs. Overstocking of products. So some hospitals they say, okay, to overcome the stock out problem because I don't have the vision, I will order for 5 or 6 months in advance. But this has a lot of consequences. One of them is the storage cost, but we have other consequences, environmental consequences or economic consequences. And this is not the optimized solution. And as a result, also, we have a lot of waste and expired products for many reasons, whether temperature sensitive products or short shelf life product. So they are still in the same motto of action, which is reactive rather than proactive management. So they are reacting after a crisis happen, after a stock out. Some hospitals, they make orders, what we call urgent orders. So they pay maybe 10 times more for a delivery because of, in order to get it the next day, because they have stock out. And this is not sustainable for the long future. So some alarming numbers. They did an experiment on over 200 French hospitals for 1 week, for only 1 week, in order to measure how many medication units are wasted and for what value. So for this 1 week, we had more than 250,000 medication units that were wasted for a value around 707,000 euros, which is not insignificant for only 1 week. 20% of the wasted drugs were still potentially usable, but they had to uh, uh, um, it had to go to waste for specific medical reasons. They estimate the unused medication per year in France between 560 million euros and 1.7 billion euros, which is huge. And they noticed a 3 times increase in the declaration of critical drug stock out since 2017. So since 8 years ago, 3 times we have more stock outs than 8 years ago, which shows the real need of intelligent tools based on AI that can anticipate the demand and help the hospital supply chains to be ready for the upcoming need. And this is where our second solution, stock, comes in very handy, because already it was used for almost 10 years in the industry for inventory optimization, and we adapted it for the healthcare sector to do dynamic replenishment in healthcare and to help the hospitals to be ready for what's coming for them as a demand for each one of those products for the upcoming weeks, months, and years. So it combines predictive analytics with real-time monitoring, and one of the added values of stock is, in fact, it continuously adapts replenishment parameters to the latest consumption trends and to the latest forecast demand. And in fact, um, uh, it's not a static replenishment parameters policy. So we have dynamic update of all those parameters in a way to reflect every day and all the time. Of course, we learn from what happened in the past through all the available data, but we also take the latest trend, the seasonality, everything that's important to make an accurate uh, um, prediction is going to be taken into consideration in our algorithms, and it's going to be used to adjust the replenishment parameters and the optimized parameters that we are going to propose to the staff. So this will help the hospital to secure supply chain in a continuous manner, less stock out. It will help them to reduce their waste once they have optimized the stocks, so they will not be overstocking. So they will optimize their stocks, reduce the waste, and since all those optimization of the parameters is going to be automatic, so this will free up the resources for what truly matters, patient care. And those resources are most of the time pharmacists, doctors, that who spend, in fact, most of their time just trying to fight stock outs, anticipate stock outs with the means that they have currently, which are not sustainable. So the key functionalities of stock. So first we do a dynamic product classification. So we have what you call a double classification based on the value and on the demand variability, which is the most important factor in this double classification. We need to create multiple classes, and we regroup in each one of those classes the products that have the same behavior, whether the value, so high value and stable demand, for example, or very erratic demand. For a very simple reason, not all the products should be allocated the same replenishment policies. So we need to allocate to each one of those classes the most adapted replenishment policy. And this is what we try to do by this first classification. Then we will optimize the replenishment strategies and the parameters for each one of those classes for all the products in the class. And we are going to adapt the parameters, the optimized parameters following the evolving patterns, the most recent trend, and the forecast. Also, we will adjust those parameters based on the forecast that we are going to do for the next 12 months. We allow the clients to do what we call a scenario simulation. So with their custom parameters, you will see how in a couple of slides. And what's also important, we will send them automated purchase alerts because stock is going to monitor the stock level of all the products in their warehouse, and it's going to cross-check it with all the optimized parameters that they have validated. And we are going to send them automated purchase alerts to tell them that, okay, be careful for this product, you need to buy X quantity from this supplier at this time for this price, etc. And all this will enable proactive procurement instead of reactive management to the crisis. So this is the main homepage of stock. And also, like in Predict, so the main homepage on the main homepage of stock, we are going to show, in fact, the situation of the day. So we have the stock value for this day, and we are going to show them with a comparison other indicators like the service level, which is the percentage of the satisfaction of demand, so of client demand or patient demand in this case. We are going to show them the CO2 emissions that's linked directly to the number of orders that they made, and the holding cost, the storage cost, and the cost, the acquisition cost, which is how much they pay to order um, the um, the drugs. And we will show them in bold what's really happened in their warehouse. So this is the current strategy. So for the service level we have in this example, they were able to reach 98.74% of demand satisfaction. So patient clients demand satisfaction for the CO2 emission that much. They made around 36,000 orders for the replenishment. They paid around 1.26 million euros to make those orders, and we have the storage costs, which are almost 1.4 million euros. And then we show them, we compare those values with the optimized values that they could have achieved if they had accepted the optimized parameters that we had already sent it to them. So for the service level, if they had validated our parameters, so the optimized parameters that was calculated by our AI models, they would have reached 99.84% of service level, so which is even less stock outs than they had. Also, if we compare the total number of orders, so here we can see that we went from almost 36,000 orders, we were able to reduce it to 15,000 orders only. So it's like almost 60% less orders for the last 12 months. So we reduced the cost that they paid for passing the orders from 1.26 million euros to 526,000 euros. So it's 700,000 euros savings just from or just by decreasing the number of orders. And the storage cost, so here you might say, yeah, we might be overstocking, etc. So in fact, the storage cost, it's directly related to the value of your stock and the amount of units that you have in your warehouse. So we can see that the storage cost went a little bit down by almost 7-8%. So which means that we did not overstock. So we were able to optimize the stock to reach better service level, to decrease by almost 60% the number of orders, which will be reflected by 60% decrease in the CO2 emissions related to the transportation of the medical units, and so a lot of savings for the warehouse. And then we show them here a comparison between the value of their warehouse for the last 12 months, so an average value for the minimum, maximum, and average value. And we can see here that we were able to decrease the value of the average value of the warehouse by more than 300,000 euros, which should be reflected by less storage cost as well. We show them a reminder of all the purchase alerts and when they were sent to them with the quantity to order. And this is just a reminder because as you can see here, we have another window that I'm going to show to you later, which is dedicated to the purchase alerts, and all the details will appear on this other window. So here it's a reminder that they didn't pass the order for a couple of products. And then we have the optimization window, and this is in fact the core functionality of stock. So this double classification that I described a couple of minutes ago. So we end up with 9 main classes. We call it the fast moving. So A for high value, B for medium value, C for low value, and X, Y, Z. We have X for stable demand, Y for manageable demand, and Z for very erratic demand. So when we have the product of class AX, which means those products are of very high value for the warehouse and with the most stable demand. And when we go to the class AZ, it means we have a very high value products with very erratic demand. And I will show you some examples on this class. We have the slow moving classes, so the products for which we didn't have any orders since at least 1 year. And we have customized classes if you want to create classes for specific handling. So when you see a class in green, it means the algorithms did not detect any change in the behavior of the products of that class. But when you see a class like AZ in red, it means the algorithms detected 19 change of the behavior, in fact, a change of the behavior of 19 products. So if we dig deeper, they can check. We will show them for each one of those products if there was a critical change or not, and we will show them a comparison between what's really happening actually in their warehouse and the optimized parameters, what they could have as impact if they choose the optimized parameters. And for this example, for the first product, they have on average 36 units from this product for a value of 75,000 euros on average. If they follow our recommendation, they can reduce this quantity to 18, so it's 50% less stocks, and with an impact, of course, of 50% saving. So they would make 37,000 euros from this item only. And I repeat, this is the class of the high value products. Of course, we have other classes. So here the impact will be more significant. So for some products, we can save more than or up to, in this example, 84,000 euros for this product. And we go even further. So we show them the optimized parameters with the impact, and they can simulate with the proper parameters. Maybe the supplier just called them and they told them that the lead time, which is the average time needed for the delivery, because of some stock out, it went up from 3 to 30 days. So they can simulate with this new information that we don't have. They will enter here 30 days. They can click on simulation and they will see the impact of the new parameters on the quantity and on the value, and they are free to validate any of those scenarios based on what seems better for them. So we don't force any auto-validation of any scenario. We send them our recommendation. They just need either to validate or to simulate, and those parameters will be taken into consideration. This is the purchase alert window, so where we display all the alerts for all the products the date of the alert, the quantity to order, the price, etc. So they can report the alert, or in fact, what they need to do from their side is only to check the purchase alerts, make the order, validate the quantity, make the order from their side, and that's it. And they don't need to do anything else. So it's a huge time savings for all the personnel or the pharmacists using stock. So we did a test. We were contacted by a very big hospital, les Hôpitaux Universitaires de Strasbourg, which they have in fact a main warehouse that serves multiple warehouse with more than 3,100 products in the fast-moving part. And we were asked to compare on the data from 2024 the current strategy that they used to have, and what they could have achieved as results if they used our tool stock. And in fact, they are very well known for their they know how to optimize the stocks. They are somehow experts in this domain, and the challenge was simple: can your system really do better than our experts, or at least do as good as we do? So this was the challenge of their manager, Dr. Raphael Pasmar. He challenged us with. So the indicators that we used are very simple. So we used the maximum, average, and minimum stock level and value, because this will show overstocking or a better optimization of the stocks. The holding cost, which reflects directly the stock value. So when you have more stock, you pay more for the holding cost, for the electricity, for the waste, for the insurance, etc. The total number of orders that was made in 2024, so less orders, less acquisition cost, less CO2 emissions. So all those three indicators are connected, and the stock out. And he didn't give us any information about the product. So he only gave us the product number without any context. And of course, we used the history of the supplier comments, the client comments, etc. But we didn't have any context about if this product has any seasonability or not, or any other context for each product. So I'm going to show you 5 products that he presented at a conference a couple of months ago, because he was at the end convinced by the added value of this tool stock for the optimization of the stock. So here what I'm going to show you is the comparison between the current strategy, what they had really implemented in 2024, and the optimized strategy by stock in fact solution. What you see in green is the actual stock level. What you see in blue, which is the same, is the actual demand, so the real demand. The vertical red lines are the points when they made an order to the supplier. And here we show you for the first product, which is from class BX, which is average value but very stable demand. We were able for this product to reduce the number of orders by 53% throughout the year, from 32 to 15 orders only. So almost 52% savings from just the acquisition cost, so how much they paid to get the order. And we were able to reduce the average stock level throughout the whole year by 24%, which is very significant for such a product. And as you can see, we didn't compromise in fact, we didn't compromise the service level, because we had around 100% service level. So having the maximum service level does not always mean to overstock. So we can optimize the stock, reduce the number of order better, and have a very high service level This is the beauty of AI and what AI can do for such problems. This is a second product, and in fact, those products, when he challenged us to see the results on those products, we didn't have any context. So it was like a test. We did our test on the 3,100 products. He called us and he was checking live. He was giving us the product number, and we had to show him the result. And we didn't know what to expect from our side, because it was like a blind test to us. So this is another product from the class AZ, which means very high value and very erratic demand. And here it's clear from the blue line how erratic the demand is. So on one day it's very high, and on many weeks it's almost zero. So for this type of product, we were able to reduce the number of orders only by 6%, so 30 instead of 32. But what's interesting for this product, we were able to reduce the average stock level by 36%. And here, from 36 units on average to 23 units. And just to give you an idea, this product cost around 3,000 euros. So we were able to reduce the average stock level by more than 40,000 euros for only one product. So even for erratic demand, we had very good results. The third product is from class AX. So we managed to reduce the number of orders by 16%. And here, for this product, it has a very stable demand on average for the last 12 months. We were able for this product to reduce the average stock level by 63%. So this is huge for a product with a stable demand, where you can at least anticipate that you will have for sure a certain amount of demand for the upcoming weeks. So usually this should be well anticipated than this product, which has a very erratic behavior. And even though with a stable demand, we had 63% less average stock level. A fourth product, which with very erratic behavior, only 2-3 demands for the whole year, even for this product. So instead of making 3 orders, we made 1. And the average stock level, we were able also to decrease it. So, and this couldn't be done without the advanced algorithms that we have for demand anticipation, and of course for the optimization of the history. But when you do it in the correct way, you will be able to improve the current result. And the last product, so here we were able to decrease the number of orders by 45%, which is significant, and the average stock level by 10%. So when it seems to you that, okay, we did 50% less orders, so of course we should have ordered more, the average stock level will show you that no. On the opposite, we can see here that we were less, or our stock level on average was less than the current strategy. So we have many benefits for this stock solution and for the use of AI in such solutions. So from the patient care point of view, so we have a service level more than 99%. So we were able to satisfy the patient's need with less than 1% stock out. And this is due to real-time monitoring, to real-time alerts, and to the powerful algorithms that we have. We were able to reduce the waste by optimizing the stocks. So you will stock less, you will have less waste due to whether product expiration date or unnecessary disposal. And we were able to have between 20 to 40% reduction in storage and inventory cost. You'll be able to buy smarter, to store smarter, not too much, not too little, and to waste less due to the optimization of the stocks. And this, in fact, is very important. So not only from the economic point of view, but also from the environmental point of view. So You can have smarter and faster decision making due to these automated recommendations and the scenario simulation that we give the clients the ability to do. Huge uh, time savings for the staff, so they will not be anymore calculating manually the parameters and checking the predictions and trying to do what the AI can do in a very good way. So it will reduce the manual tasks and the repetitive tasks that they do, so they can focus on patient care. What, in fact, and this is what matters the most for them. And we have a more sustainable and responsible management by minimizing the waste. We have a positive environmental impact, less CO2 emissions, less waste, less medical waste. And this is very important in today's healthcare system. So, by using stock, the hospitals can move from uncertainty to anticipation, from overstock and waste to efficiency and control. They can lead and not chase, and this will free the staff, the pharmacist, for what truly matters, the patient care. So they can move from reaction to leadership, from chaos to control, and this is very important in today's and tomorrow's hospital. So I will conclude by how I see tomorrow's hospital, today's and tomorrow's hospital, which I call a predictive hospital. So now we have data. We have powerful AI tools that help us, in fact, to transform this data into insight, into foresight, into anticipation. So it's not enough to have um, accurate predictive models, but what should we do with the data that we generate, that we calculate? So we need to move from prediction to action. So we need to transform the hospital data into real-time decision, whether to anticipate patient flow or resources or supplies before the crisis emerges and not after. Today and tomorrow's hospital is going to be about breaking the silos between the different departments of a hospital. So when we give you the visibility on the next weeks and months that you are going to need you are going to have that much hospitalization in this department. So if you don't communicate with the other departments and try to anticipate this need, this peaks, whether from the logistics point of view or HR point of view. So if you don't share this intelligence, sorry, you will not be able to, in fact, anticipate and be proactive to the future crisis, and you will remain in the reactive management. So also a predictive hospital is the one that in fact empowers healthcare teams. So we give the analogy of the firefighters. So if you know how to anticipate and to read properly the predictions that the powerful AI models give you, you will be doing less firefighting, more foresight, and better care. So in summary, a predictive hospital is an agile, data-informed, and human-centered hospital, and this is what's starting to happen, and it's going to happen in the next couple of years. And this is what we are trying to do at Optacare. So we are turning the data into foresight with our four solutions. So I didn't have time to talk about the other two solutions, which are as important as the first two. So with Predict, the hospitals can anticipate patient arrival and waiting time, and and it's connected to our second and third solution, which can align staff and patient pathways with real-world dynamics. And with stock, the hospitals can secure their supply chain while minimizing waste and optimizing their stocks and increasing their service level. So the foundation of a predictive, proactive, and people-centered hospital, this is what a predictive hospital do, and a hospital that leads rather than reacts. We know that it's only the beginning. what we are doing is not going to, it's going to revolutionize a little bit the healthcare system, but it's just the beginning. So the forecasting, the optimization, and the decision support. So tomorrow's healthcare system will be guided by predictive, prescriptive, and adaptive intelligence. And I'm going to show you quickly a couple of examples that what's going to happen and what has started to happen already in some fields, like in the predictive diagnosis field, where some AI models can surpass humans in some fields like cancer detection, fractures detection, heart diseases, Alzheimer, or Parkinson's, based on biomarkers, on imaging, and even on voice. So the AI models can detect some cancers while doctors are not able to see those tiny points because they miss it. So this is a human, normal human weakness. In the field of personalized medicine, so we will be able in the next couple of years, I guess, to tailor the care to every patient history, to every patient biology. So we will be able to test some drugs based on where you come from, your ethnicity, your biology. So all the data related to you as a person. The clinical AI copilots that will help the caregivers, the doctors, in some repetitive tasks that uh, can really avoid doing, like real-time summaries, recommendation. And what I see coming for the next 5 to 10 years, it depends on how fast it goes. So we have the digital twins of patients. So when you have a virtual replica of each one of us, and you can simulate, or doctors can simulate, how our bodies are going to react to certain treatment. So by doing simulation, self-driving hospitals, of course, from the point of view of the management, the patient flow, the staff, and the logistics. Collaborative multi-agent AI systems. So we talked a lot about the AI in one hospital, but what's really important is the inter-hospital coordination and regional resource optimization, not only on a level of a hospital, but on a level of the department, the region, and we will reach to a point where we will do a national, or it will be on a national level, on a country level. So we will have like forecast based on for all the population, and why not connected to the neighboring countries, in order to predict the epidemics, the shortages, and the seasonal peaks during, using the anonymized national data. So in summary, the next decade won't be about automation, it will be about anticipation, and this is the key word for the next decade. So we need to use AI and to know how to use AI to empower healthcare to, instead of react to crisis, to lead with foresight and with humanity, improving the efficiency, the resilience, and the patient outcomes. So this is, to me, the key for the next decade in healthcare. So thank you very much for your time. If you have any questions, I'll be able to take them now.